All my life, I've experienced illness in some shape or form, mostly consisting of endocrine or rheumatoid disorders. However, in 2009, my health hit rock bottom as I developed a new devastating condition. I was unable to walk due to exhausting fatigue. Out of all of my symptoms, epilepsy, triggered by sound, was the most prominent. A car honking, a phone ringing, or even someone speaking just a little too loudly could all trigger a seizure. Some people might think that when you have a seizure, you go unconscious, but this isn't always true. Mine felt like I was being burned, electrocuted, and ripped apart all at once. If that wasn't enough, I was prone to going into respiratory arrest, and at my worst, I was getting up to 40 seizures a day. Every day, moment by moment, I was fighting for my life. I was terrified as my body slammed into the floor, my head bouncing on the linoleum, that I would die from my own body trying to kill me. All of this, and not even mentioning the emotional and social, life-altering effects that this terrible disease had hold on me. Friends and family were all terrified to trigger my seizures, so for the most part, I felt alone. As you see today, I'm not having a seizure. So what changed? Going from 40 seizures a day to 3 a week with just lifestyle changes is hugely significant. And unfortunately, my story is not unique. My initial guide into managing disease through lifestyle was as an undergrad. One of the first significant findings for me was that nutrition was literally the building blocks to your body. For example, you have amino acids from proteins that contribute to DNA and cellular replication to help your body maintain homeostasis, which is just a fancy way of saying that it's keeping your body alive. I became familiar with cases such as the Dutch hunger study, suggesting that chronic disease can originate in a fetus if a mother is not getting proper nutrition when pregnant. And these health effects can even be seen later in grandchildren. Or how nutrition insecurity can be seen in skeletal analysis. Interestingly, we see more disease progression after the rise of agriculture, not beforehand, when we were hunters and gatherers. We see further disease progression with the introduction of refined cooking techniques. When Europe's royal houses introduced things like white flour versus whole grain flour. I found these things interesting because as a child, I thought I was eating healthy. But was I really when I wasn't even eating school lunch? White flour and white rice were a staple for me growing up. And I reflected, did that have anything to do with my poor health? If our ancestors were used to eating hundreds of plant varieties, and I was only getting maybe an average of 14 on a regular basis, was that really enough to sustain my body? Think about it. You eat carrots, celery, your typical vegetables. But what about herbs and other foraged foods, such as burdock, plantains, sassafras, sorrel, purslane, and spicebush? These are all things that grow in New York City, yet most of us haven't even tried them. Most of us know, it's common knowledge, that you can prevent and manage many diseases with lifestyle changes. Chronic diseases that are plaguing our society, such as cardiovascular disease, hypertension, diabetes, and even certain cancers. The World Health Organization estimates that an average of 60% of your health outcomes are determined by your lifestyle. We know these things, so why are health outcomes so much worse in America than they are in any other industrialized nation? If heart disease can be prevented or managed by lifestyle changes, then why is it a leading cause of death in America with an average estimate of someone dying every 33 seconds from it? A journey towards health is helped by individual education, learning about nutrition, making lifestyle choices, But we cannot address the systemic issues that have created without addressing the problems and the foundations that America have created. As a society, we tend to focus on what an individual does or does not do. If someone is overweight, it is seen as proof that they're lazy. When I walk into a doctor's office, the first thing that they assume is that my health status is because of some way I have failed. I must be the one not eating healthy or working out. Until they actually hear about my diet and exercise routines, and then it's usually followed with disbelief. This type of reasoning is known as the fallacy of personal attack, where it's not based on facts, but assumptions that attack a person. And sadly, we see this in our society, where Americans strongly believe in the ideology of individualism, attributing personal outcomes to an individual rather than the social system. The fact is that health is more complex than that. It's synergistic and multifaceted. Let me give you a different perspective on this. In the social determinants of health, one's health is heavily tied to external factors such as economic stability, education, social community, and the environment that people live in, which increases an additional 30% of health outcomes. Elevated cortisol levels due to constant stress has been shown to increase these disease progressions. The Whitehall study and the weathering hypothesis demonstrate how systemic racism and the socioeconomic gap has contributed to health decline. The physical environment also plays a huge factor in chronic health development. For example, people develop cardiovascular disease at higher rates in areas that are heavily polluted. You know how much pollution we have in this city? And going back to food, our building blocks to health. How can someone eat healthy if they can't access healthy food, if they live in a food desert or food swamp? The Bronx may have an abundance of food, but what is the quality of that food? And why is it accessibility to affordable, fresh, and nutritionally dense foods hard to come by in this area? Speaking of healthcare, about 25% of Americans don't even have medical insurance. And those who do, many with high premiums, have to choose between getting regular checkups or paying rent for the month. And this is compounded for citizens with chronic health conditions. For me to eat a variety of healthy foods, go to multiple medical specialists every month, get MRIs on a regular basis to see the progression of my diseases, and to get medication for my chronic illnesses so that I could function, there's not much left for other expenses. But even if you don't live into a disadvantaged area, the health crisis still impacts you. An estimated 133 million Americans, that is nearly half the population, suffers from at least one chronic illness, such as cardiovascular disease, hypertension, or arthritis. Even if you're not one of these 133 million, you could develop one of these conditions. And if you're fortunate enough never to develop one of these conditions, I want you to think about the people in your life right now. By a show of hands, how many of you personally know somebody that has a chronic condition, maybe diabetes or cancer? How many of you have lost somebody you loved due to a stroke? I have too. Actually, I lost my father due to a sudden stroke on March 31st, 2019, 5 years ago. On April 6th this year, he would have been 71 years old. And yesterday would have been my parents' 53rd year wedding anniversary. I want to paint a picture for you of what it's like for somebody when they have a stroke. On the last day that I spoke with my father, he described symptoms that to me sounded like pre-stroke. The next day he went to the ER, and he was given medication for very high blood pressure and was in the process of being discharged when he had his stroke. Quickly, he fell into a coma. He was put on life support, and he died shortly after. A stroke is not just a stroke, as it could change your life in an instant. I want to give a huge shout out to my amazing mom who's in the audience here today. To go through these things, to put it plainly, it sucks. But I honestly believe that we all have the right and decency to health and happiness. You have this one life, which is such a precious gift that allows you to enjoy everything you experience. There's this really profound story called The Boy and the Starfish that I really love. A boy and his grandfather on a beach which is littered with countless starfish. One by one, the boy's picking up each starfish and he throws them back into the ocean. And the grandfather responds to him, "That's not going to make any difference. There's thousands of starfish." And the boy picks up another starfish and throws it into the ocean. He says, "It made all the difference to that starfish." We could all make a difference for ourselves and for each other with 4 simple action steps. So what can we do about it? Number 1, to make effective change in your community, you can look to the social change model as a foundation. Knowing your values, making your actions aligned with your values, and joining them with a group in your community can help you work towards a common goal. It's easier to accomplish things when you're working together as a team. One way that Lehman College did this was by knowing that there was an issue of food insecurity on our campus. So the Office of Campus Life, the office that I work under, started connecting students to organizations, professors, and even celebrity chefs to teach them the tools to go out into the community. We emphasized topics such as urban gardening, cooking sustainably from scratch, qualitative and quantitative research connected to food insecurity, as well as advocacy skills. Many of the students knew that this was an issue, but did not know how to address it until we helped them and guided them as a supporting team. Tap into your existing networks, your neighbors, your coworkers, YMCAs, your classmates. There are tons of organizations out there that can align with your goals and help build on this collective strength that you already have. Number 2, look to see what other organizations and communities have done and advocate for those in your community. Humans are not any smarter than they were thousands of years ago. Yet the reason why civilization has built is because we've built upon ideas for improvement. In Finland, they have bike lanes on the sidewalk, which encourages exercise, as opposed to bike lanes in the street, which can be scary and discourage using them. In Japan, food is subsidized, as it is considered a basic human right. I think the most that I spent on food in Japan when I was studying abroad was about $5 for a full set, which is your soup, rice, protein, vegetable, and a refillable drink. In Finland, you could get gas station food with a free salad bar with a huge variety of vegetables as a main part of the meal. I asked someone in Japan why they subsidize the food, and they said, because it's important to us. It's a priority. And in Finland, why they had such a vast variety of food with vegetables was simply why not? Policy change is a choice, though. Look up your local representatives and write to them. It's literally a politician's job to serve us, so it is important that they know what you stand for. Vote for those in your community for ideals that you want to implement. Government officials can push for tax incentives and also establish laws for healthier options. Number 3, decide that health education is a priority for our youth. Not only does this help establish behaviors early in life, but this has been seen to affect health outcomes with lifestyle changes later in life as well. We see this across the board with all health topics, such as addiction prevention to healthy eating. And speaking about eating in school, you can actually prevent osteoporosis as well as other chronic conditions that we see later in life if given the right nutrition in adolescent years. These are life skills anyone can use. Number 4, know that you are not alone in this. There are countless of people out there that have the same passions and have been actively working towards this. Change is a process, but we can't move forward unless we take one step at a time. Just connecting with others is an important first step, and it's actually been shown to help you live longer too. So today, look up your local representatives and see where they stand on health issues. Look up your schools and community organizations to see what programs they're offering that you could participate in. Research what healthy foods that you might be able to implement in your life and how to make it sustainable, efficient, tasty, and affordable. Let's take this first step today. I have faith that together we can make positive changes to improve our nation's quality of life. Thank you.